purple in it. My trouser is purple. The whole month is a purple month. So when we say purple month, what do we mean? Purple month is a mental health awareness month. So it's a month that has been set aside to celebrate mental health and to make people aware of mental health. It was pioneered somewhere 2024, so that in every month of May, we celebrate mental health. So I would say that whoever chose May for mental health did a very good task. All right. So if you look at my slide, you see May is purple month. So I want to talk a little bit about the colors. So purple, what does it mean? Purple means we are encouraging hope and encouraging people who have mental health issues. We give hope, we are giving encouragement to people with mental health issues or people who are caring for individuals with mental health issues. And then when it comes to the green, it's about mental health awareness, creating awareness to people about mental health, that there is something called mental health. And if you don't take care of your mental health, you might develop a mental health illness. And then the white is talking about mental clarity, wholeness. So basically, this is why we chose these colors for mental health, right? Okay. So this year, our theme for the Purple Month is mental well-being. My voice matters. Everybody's voice matters. People who have mental health disorders, people who have family with mental health disorders, their voice matters. And even those of us who have not identified that we have any mental health disorders, but we have some kind of emotional challenges or anything, our voice also matters. And this is the universal logo that you see on our shirts. The shirts of those who are newborns. Okay, shall we move on? So, understanding what mental health is, we want to understand what health is. So when we talk about health, what is health? The World Health Organization describes health as a complete state of physical, mental, social, and spiritual well-being. So health is also looking at our spiritual well-being. It is not only biologically. You go to the hospital and they say there's nothing wrong with you. So if you look at the end of my definition, it says it is not merely the absence of disease. Oftentimes you feel like if I don't have malaria, if I don't have fever, if I don't have any physical symptoms going on with me, then I am healthy. But the definition of health doesn't say so. It says that even if you can look through your body and see that, okay, I'm not ill, or I have malaria, doesn't necessarily mean that you have a good mental health. So let me take that again. It says that if you look through your body and you do not have a physical illness, it doesn't mean that you are healthy. If you look through your body and you do not have a physical illness, doesn't necessarily mean that you're healthy. You have to be healthy on all four: your physical health, your social health, your mental health, and your spiritual health, to say that we are healthy. Okay, so we have a scriptural emphasis here. Luke 2, verse 52. It says, Jesus grew in wisdom, mental. He grew in stature, physical. And he grew in favor with God, which is spiritual, and all people, which is social. So we have an example to look out for, which is Jesus, who grew in all these areas of health. So it is very important that we look at health from this focus. We also have the boy Samuel also growing in this focus in 1 Samuel 2, verse 26. Okay. So moving on to health. Health being an individual's well-being. We mentioned that if you are not physically sick, doesn't mean that you are healthy. So what are some of the areas that we'll look out for aside from physical? The physical I've talked about a lot. The body structures, the genetics of the person, what makes the person you, what makes me different from Sister Honam, What makes me different from Ernest, So these are the things that make us different, and biologically, they are the processes of the body, right? If something goes wrong, then physically you have an illness, or something is wrong with you to the extent that you have to go to the hospital to go and see a doctor. The next one is mental. When we talk about mental, our mental aspect of health is looking at the way we think, the way we feel, and the way we behave. This thing is very, very linear. Oftentimes, the way we think affects the way we feel. And as human beings, we have negative cognitive bias. What do I mean by that? If anything should happen at any point in time, the first part, your part of your brain would move towards a negative, outlook of the thing. For example, as we sit here, let's take that people are making noise outside the gates of this space. In your mind, the first thing that would go on, what is going on? What is happening? It is always going to be a negative bias. Until you find out that it is a positive thing that is actually going on outside there. So many times our mind moves towards the negative. And it is very instinctive, because growing up, as children and up until where we have gotten to now, we've always been trying to protect ourselves from danger, one way or the other. If you grew up in the farm, you know that you should make sure that snakes, you take care so that snakes will not harm you and all of that. So instinctively, it has become part of us that we look out for the negative first before we look out for the positive. So the way we think oftentimes affects the way we feel. You will not be thinking positive thoughts and be feeling negative. But you'll be thinking positive thoughts and be feeling positive. And if you feel positive, then you behave positive for people to see that you are feeling and thinking positive. The next one is social. How the person relates with people in their environment. In their workplace environment, in their home environment, with their family members, in their culture. These are some of the areas of social well-being. Is it appropriate or it is inappropriate? And then the third focus is spiritual. The spiritual well-being of the individual also plays a very, 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 very big role with the person. We have individuals who come to the hospital, and then sometimes, the person is not feeling right with God. And there are times when you'd have to even call in a pastor to come and be with them, to pray with them, so that they feel like, and yes, will be a trauma, and I guess say spiritual. But God, whatever sin that they feel that they've done so big that God cannot forgive them, has been forgiven. So we have pastors even in our support system, our multidisciplinary system for people. All right, please let's move on. So then again, what is mental health? The definition of mental health is looking at a healthy person, mental health. So it says it's a state of well-being in which the individual realizes his or her own abilities, what I can do, what I cannot do. The individual can cope with the normal stresses of life. It is not that stresses will not come, stresses will come, but you are able to cope with the stresses daily as they happen to you, can work productively and fruitfully. So it's able to work, can go to work, can function at work, can be able to do their work. That is the focus. And is able to make a contribution to his or her community. So can work and can also give back to the community. That is mental health. And that is defined by the World Health Organization in 2004. Right. So then again, seeing the definition of health, we have also seen that mental health is also not only the absence of not having a mental illness. Right? Okay. So the way the individual thinks, feels, and behaves is very, very important, because that is the bedrock of mental health, right? So we have 4 Ds of mental health: distress, dysfunction, damage or danger, or deviation. Before somebody feels like my mental health is depleted, my mental health is bad, my mental health is low, oftentimes the first thing we look at, is it distressing the person? You are just there randomly and you begin to cry because you have some kind of depression going on with you. Randomly, you just are not feeling like you are yourself. You feel very down. You don't know what to do about that feeling, but it is just there, always present. That is one of the focuses. Is it causing distress to the person? The second one, is it causing dysfunction to the person? Is the person not able to function well in their daily life? They are not able to wake up to take care of their children. They find it very, people call it laziness. They find it very difficult to get up to take a shower, to take a bath, to get up and go to work. You know, all the functions of their life, we see some dysfunction going on there. Are they thinking about damage? Are they thinking about taking their own lives or the lives of another person? So are they homicidal or are they suicidal? That's also another focus. And then deviation is the fourth D. We look at it from the focus of deviation from the normal. Are they hearing voices? Are they seeing things that are not there? That is the fourth D of mental health. This is also talking about the biological, psychological, social, and mental well-being. So this is just a pictographic diagram of that. So let's move on to the next one. So the next one is talking about the mental health continuum. We've talked a lot about what mental health is. But when it comes to the continuum, we need to understand that nobody is always at green, flourishing. You can be at green, flourishing now, right? But some issues can happen, and then you move from green to suffering. But then this is more of like a thermometer or a number line, a continuum, which would help you know where you are. The first one is green, flourishing, often normal. In our medical terms, we call it normal state. The next one is managing. In our medical terms, we call it mild. Are you exhibiting any kind of mental health disorder that is in a mild state? If you come at a mild state, it will be easier to help you because it means that your symptoms will not have been so many, so we can be able to support you. Then it moves to languishing, moderate. It's moved to a point where the symptoms are a bit more than the mild. Then it moves from there to struggling. The individual is really struggling, which is severe. Then it moves from there to suffering, which is extremely severe. And sometimes to the point where they can't bring themselves to the hospital, somebody would have to bring them because it's so bad. So this is how our continuum looks. And somebody can move from flourishing to suffering, flourishing to languishing at any point in time because things happen to people. All right. So moving in that line is moving from good mental health to midpoint, then to mental illness. So mental health, we don't have anything called mental disease, but it is mental illness or mental disorder. So in moving through, why do we move through suffering to flourishing to managing to languishing? What is it that is making an individual fluctuate through these emotions? We call something the 4 Ps. Right, the 4 Ps. P, letter P, the 4 Ps. So when it comes to the 4 Ps, we have the first one being a predisposing factor. So when it comes to a predisposing factor, it could be genetics. It's in the family. There's bipolar in the family. There's depression in the family. There is schizophrenia in the family. So there is something genetically going on in the family that predisposes a person to having that particular condition. Because of that, you might get it. It is not that because it is there, you will get it, but you might get it. And then psychological, trauma, childhood traumas. Some people have been sexually abused. Some people have been physically abused at formative stages in their lives, which has created scars in their brains. And so it puts you at a point where you could develop a mental health disorder, especially if you do not seek help timely. The next one is the precipitating factor. That is the immediate trigger to the condition. Oftentimes, the precipitating factor can be breakup, Broken hearts. Yes, broken hearts can be a precipitating factor. You have lost your job suddenly. Divorce suddenly. It can be something debilitating, really bad for the person. That could lead to that. And it's an immediate stressor which could make whatever mental health issue that was laying low now raise his shoulders and his head to tell you that I am there. Okay. And then we have the perpetuating factors. Perpetuating factors are factors that enable that mental health condition. It allows it to stay. It has come, but then it will allow it to stay. So perpetuating factors can be how you're coping, the way you are taking alcohol, you're taking substances, anything that you are taking to numb the pain during that time could be a perpetuating factor. Because whatever it is we put in our body, like substances, they have chemicals, and they can get into the brain and do what they want. So when that happens, it could actually aggravate a mental health condition or disorder that somebody has. And then we have the protective factors. Oftentimes, the protective factors are factors that would help you alleviate or, get out of the problem or lessen the burden of the condition, like your support system, your church, your family, your friends. These are some of the protective factors that help individuals. All right. So then what is mental health disorder, or what is mental disorder or mental illness? How we say mental illness or mental disorder? It's conditions that affect the way you think, feel, perceive things, and behave. When we say overt or covert, it could be the way you behave outwardly for people to see, or inwardly. And you think people are not seeing, but they are seeing. So these are some of the ways that we see that an individual has mental health disorder. If you look at it, it goes beyond thoughts, feelings, and behavior, but also looks at perception. You thinking that somebody can hear what you are saying in your head. That the radio that is being broadcasting is broadcasting your issues to everybody in the world. So some of these things are perceptual, and they also identify if an individual has a mental health disorder. So mental health disorder can be one-off. Can just be once, and that is it. You went to give birth. You had postpartum blues. Postpartum blues is oftentimes when the women give birth, 1 to 2 days after birth to about 4 weeks, they are just irritable. They are sad. They don't know what's going on with them. Sometimes they feel like taking the lives of their babies and all of that. Yes, it lasts for a short period of time and may not even happen again. That is occasional. Acute stress reaction. You are sitting in a car, then you hit somebody. That trauma of hitting another person, and during that period, it comes with a lot of stress going on in their mind. Some people, they can resolve it in a very short period of time, but if it's not resolved, then it becomes post-traumatic stress disorder. Okay, then we have the intermittent or long-standing ones. Those ones, if you are diagnosed of it, you'd have to live with it for the rest of your life. Like major depression disorder, schizophrenia. Yes, so some of these disorders are there. And typically, the Ghanaian will say the person is mad. But they all have their distinct, should I say, symptoms that will make us identify that this is schizophrenia or bipolar or the big names I am mentioning. Okay. So a mental health disorder causes distress to the person. It causes impairment in the person's function and judgment. So sometimes they do not even think that they are sick. There's nothing wrong with me. Why did you bring me to the hospital? I don't understand why you brought me to the hospital. It can get very, very aggressive with you too at times, depending on the severity of the condition. Yeah. So there is no illness called madness. In fact, retardation, madness, there is nothing like that. When you call people like that, we are stigmatizing against them. And so you can say somebody has a mental illness, somebody has a mental disorder, but there is nothing called madness. Yeah. Yes. There is nothing called madness. Okay. Mental health disorders have varied, such as we have with physical illnesses. We have plenty of them. I'll get to that slide soon. So that is the next one. The common mental health disorders that we have. So, alcohol and other substance use disorders. I'm sure a lot of people have not seen this as, or do not think this is a disorder. Yes, it is. We have individuals who have alcohol and other substance use disorders like cocaine, marijuana, tramadol, over-the-counter medications that they are abusing. That has become a mental health disorder. Because all these substances get into your brain and your spinal cord, and then substances that get into your brain and your spinal cord, God has already created chemicals in your brain. So when they go there, they begin to mimic. They behave like the chemicals in your brain. So you realize that when somebody doesn't have it in their system, then something is off. They need to get it in their system because it has been mimicking the processes of the chemicals in your brain. And oftentimes, the quantity of the substances people take is more than they should. So they take it and they get euphoric, they get excited, they get happy. And so when it is not there anymore, then something is off. And the chemicals in your brain cannot give you that level of euphoria. So you always find them going back to the substance, and that is a disorder. Psychotic disorders, then I have mentioned schizophrenia. So schizophrenia is often the disorders you see people walking around the streets of Accra in Ghana, and we think that they are mad. So that is it. They'll be talking to themselves because they are seeing something you are not seeing. They are hearing something you are not hearing. They are feeling something walking around their body that you are not feeling. They have hallucinations of all the senses. They can smell things, they can see things, they can taste things, they can hear things that you are not hearing. So then they are in their own world. That's why we say mental health disorders also affect the perception of the person. So they're being in their own world. They are doing all these things. And they need help. Because if they knew better, I am sure that they will not be in that state. So psychotic disorders. Then we have mood disorders. Mood disorders like depression and bipolar disorder. A lot of people have heard about depression. And sometimes when you see somebody who is very sad, oh, this person is depressed. Yes, the person might be depressed, but every time I say that, before anybody is diagnosed of any of these conditions, he needs to have a mental health professional do an assessment to say you indeed have this condition, else you are labeling the person. Somebody might just be going through some momentary something that is making the person feel sad, and now you are saying the person is depressed. So we need to be careful of how we say people are depressed. Depression is sadness that can go on for months. There's nothing that is making this person happy. They lose interest in things. They do not want to go out of their home. They just want to be by themselves. They lose interest in things that they used to like, sex, anything. You know, so these are some of the disorders. We have a mood disorder. We also have bipolar disorder. Bipolar disorder is where there are extreme swings of mood. So the person is happy, manic, very excited, excessive energy. The energy can go on with them not sleeping. They can go not sleeping for days because they are very energetic, very excited. Also with risky behaviors. They can sleep with anybody randomly. They can take videos randomly. They can do whatever they want randomly. And that is when they are in the manic phase. So when they come out of the manic phase and they come to the depressive phase, that's when it is tinged with guilt, anger, sadness. Why did I do these things? Why did I post them on social media? And all of those things. So these are some of the things that we have. And then neurodevelopmental disorders like autism. These are disorders that affect the growth and the development of the brain of the child. And so you have a child who has challenges with understanding communication, social interaction, and is doing repetitive behavior. Can be looking at the ceiling and likes how the ceiling is looking and can just sit there and be there. Call his name, he wouldn't respond. You call his name multiple times, he wouldn't respond. You give him an instruction, he doesn't get it. He throws tantrums. He does self-injurious behaviors, throws his head to hit the wall and all of those things. So That is autism for you. And then we have the neurocognitive disorders, dementia. So that is where the person's cognition is declining. It is going down. We have senile dementia. We have senile dementia is elderly dementia, 60 plus, having dementia, their cognition is coming down. We also have dementia where it is not senile. Prior to, like around age 30, 40, they are already experiencing dementia. Personality disorders, like borderline personality disorders. Borderline personality disorder is very similar to bipolar disorder, but then this is a personality of the person and cannot be changed. And even if it can, it will be very difficult for you to change that. And then we have anxiety disorders, generalized anxiety disorder. Anything can trigger the person's anxiety. All right? Anything can trigger the person's anxiety. Pain, sorrow, anything can trigger the person's anxiety. A plate has been dropped on the floor, can trigger anxiety. Somebody has opened the door, can trigger anxiety. Hears music, can trigger anxiety. And then marital problems, stress-related disorders like PTSD, sexual dysfunction disorders, premature ejaculation, vaginismus, all of these things are mental health disorders. And then impulse control disorders like gambling disorder and kleptomania are also mental health disorders. All right, please, let's go. Okay. So factors that affect one's mental health. Childhood trauma or abuse, we've talked about that. Bereavement, you losing somebody very important to you, most especially mothers losing their babies. It plays a very big role here. Long-term physical health conditions. This even makes us understand how our physical health is so much connected to our mental health. Because of these long-term physical health conditions, the person is there on hospital bed for a very long period of time. There are times when it triggers a mental health condition, like depression, unresolved childhood mental health disorders. There are individuals that grew up with ADHD and so many other conditions they never knew, because during the time that they were children, we didn't have as many mental health professionals to tell them that your child is having ADHD. So they've grown up with it, and it has complicated and has become another condition. Severe long-term stress, whether at work or at home, also can lead to that. After birth, I've spoken about postpartum blues, postpartum depression, postpartum psychosis as well. And then marital relationship challenges, they also can lead to mental health conditions. And then domestic violence, being hit, being abused daily in the house, you know. Sometimes it is not physical, sometimes it is emotional, sometimes it is psychological. The words that they use to describe their spouses can trigger mental health conditions. Drug and alcohol abuse, physical causes like a physical injury to your head because of maybe an accident, and then birth defects, cleft lip. There are so many birth defects. Down syndromes. Down syndrome by itself leads to poor cognition. So you have a child who is 15 years with Down syndrome, and she thinks like a 5-year-old. Yeah, so genetic predisposition. So what is the prevalence in Ghana? Many Ghanaians are living with undiagnosed mental disorders. Many Ghanaians are living with it. Number one, because of the stigma. They don't want to see a mental health professional because of whatever they are going through. Even us, we are stigmatized against. How much more them? So from what we have, 13% of the total population of adults experience mental disorders. But this is not the true representation, because people are not coming to hospitals. So we might not really have the true reflection of what is going on. It can even be more than this. And 2% of 98% of these people are coming to hospital. So we have 98% of people out there who are not receiving care for mental health conditions. Thank you very much.
Let's do it better. So we want to take 5 minutes of the time for Q&A questions so that she can respond to them. So if you have a question, you can walk to any of the microphones on the left or the right. It might not be something directly to you, but you want her to at least throw a bit of light on some particular area you have been disturbed or thinking about for a while now. So let's do that. I know when it comes to questions, some of us, we are shy and all that, but your question may be an answer to somebody's issue. So let's do it quickly. 5 minutes, then Akpene will answer. Has she done very well? Let's put us together one more time. So let's receive questions. Let's receive questions. Akpene until see your catch will be say what bodama and kaho. Okay. So we have to stop using wabodam. Good. Question, let's go. Quickly. Or prayer temple, let's ask questions. God bless you. Just stand behind the microphone.
One that just wants to sleep with anyone. It can be someone's wife, it can be a child, it can be anybody at all once you are available. Yes. But another thing I've recently heard, the same person now can just be there and shouting, crying, rolling on the floor. So what kind of condition is that, and how can the person be attended to?
Okay.
Thank you.
All right. Thank you very much for the question. So I would say that is a bizarre behavior. Like, it's an adult, right? An adult, okay, throwing himself down and crying and all of that. But we can't identify now if we do not do an assessment, because there are so many disorders that mimic it. It could be schizophrenia, it could be autism, it could be pedophilia. So there are so many disorders from just the description that you're giving to me. So he would have to come to see somebody in any of the mental health facilities so that we can be able to give the right support to him. Right. Medications often help.
I have a question. Just walk to the microphone. Just walk to the microphone. If you have a question to ask, walk to the microphone. Good. Okay, the second one from here. Okay, Adelaide, sure.
Okay, thank you so much. That was a great presentation. You mentioned ADHD, which is attention deficit hyperactive disorder. I want to find out, since we have the Sunday school and we deal with children, what's the best way to help children with this condition before it escalates to mental health issues?
Yes, okay. So if you have identified that any of your children at the Sunday school is very hyperactive, they need to watch it, likes fighting, does not pay attention when they are teaching, kindly come to the hospital for support. So you can bring it up to the parents. And all of that. So could you help? Because some of them with the ADHD, number one, could be as a result of phone use, overstimulation. The dopamine is very high. They are not a phone. The child is always being given phone. So they need to look out for that. And most of the times when screen time is decreased, it helps. Others too would need medication before it's toned down. So it's that no two ADHDs are the same. Yeah, all right.
Yeah. First of all, thank you for a wonderful presentation. There are a few things that you mentioned that I feel like you could probably address a bit differently so that people can connect. There's a tendency of, feeling that we are all normal and everybody is not. And you use the word they a bit much, and we all have mental issues in one way or the other, right? And I think it's important that we are made to be able to embrace it. It could be temporary, momentarily issues that you are dealing with, or permanent issues that you're dealing with at work, at home, or anything like that. So whilst listening to you and enjoying the presentation, I felt a little bit uncomfortable that that stigmatization seems to be resonating through the form of they, they, they. So I think we should all be made to embrace that. First of all, there are things that, some disorders that we are born with, right? And those can be treated, and there are avenues, professionals like you are there to treat and prescribe the needed support to, help us balance those chemicals in our bodies and stuff like that. Also, psychologically, people could be going through so many things, especially in this time and age, with so many pressures on life and stuff. So how we can also change our outlook to life, our purpose, to see life in a more positive, inclination than always to see those type of things and stuff. So fantastic presentation, but let us also understand that we are predisposed and could be easily inclined to exhibiting some mental disorders in our daily activities.
Okay.
So
thank you very much. Yes, so when I got to mental health, I mentioned we, but when I got to mental disorders and illness, I mentioned they. Because you have not gone to see a professional and he's told you that you have a mental health condition. So I wouldn't label anybody in my presentation, reason why I use they and not we. Thank you.
Thank you. I really admire the fact that you said a lot of people do not go to the hospital. I don't think it is largely because of stigmatization. I suffered an accident 2 years ago, and aside the physical cost, I was diagnosed with PTSD. I could just wake up in the middle of the night and don't sleep for days. But mental health is expensive. It's not that people don't want to go, it is expensive. 30 minutes of therapy is more than 500 cedis. And this is a person that is crying and wants to talk. How many hours can you do in a day? So I don't think people don't necessarily want to go. I went just once. I didn't go again. It took the grace of God and my mother's prayers to be normal, to be able to go to work, to relate with people. Even now, I still think I suffer it sometimes because there are weeks I don't want to see anybody. Not because I'm offended or anything, I just don't want to be around people, you see. Are there more affordable ways for people to access a mental health treatment or help? They say black people don't like therapy. There are people who want to, there are people who are interested, but the cost. So can you advise us, like, are there more affordable? Thank you.
Thank you very much. Okay, yes. So I can say that a part of it is because of the fee that comes with mental health care. But we have these government facilities, 37, I think we charge 170 Ghana cedis for an adult who is coming for the first time. The second time, 150 Ghana cedis. Also, we have heard that the National Health Insurance might soon begin to cover for some mental health conditions. So that is one option that we could look out for. But I know that in the government facilities, when you go there, it is much cheaper. Oftentimes, the private facilities, it is more expensive because it is very difficult to get one of us. We are so few. So when you get one of us into your facility, it's a hot cake. So that's why.
All right, so thank you very much. Great presentation, Akpene. Yesterday, I was having a discussion with a friend, and his firstborn is on the spectrum. I mean, the autism spectrum. So every now and then, their secondborn, they keep looking out. Is she showing signs of that too? I want to know which zones, for instance, if you take the ages, which zone will you say that now you have entered a safe zone? Or is it possible that even as an adult, you still come back with the symptoms of autism?
Thank you very much. So when it comes to autism, oftentimes you find it at the childhood level, right? Yes. So latest by age 3, they are coming for assessments for us to see that Is it autism? If it is autism, where are you on this spectrum? The severity level on the spectrum, so that we can identify which support we can give to you, right? Minimal or substantial support to you. So latest by age 3, they should be coming for assessment. So 3, 4, 5, you should know whether your child has autism or not. Yeah, and it doesn't transcend to adulthood. ADHD does. Now we have adults who didn't have ADHD as children having it as adults. So that is different from the autism.
One from here. Sammy, please lower the mic stand for mine. Yes, please.
So, thank you very much. Looking at all that you said, is there anything that you can do to build mental toughness, since the stress is a normal thing we go through? Thank you.
All right. Thank you very much. It's my bad. I was meant to say that, but I realized my time was going, so I said, okay, let me keep that for second service. But then we can do relaxation. We have relaxation exercises that help people cope with their stress. You know, I say stress is like a bucket in the head where you are filling things up in it. A bucket has a capacity, and over a period it gets full. So you have to take out from the bucket, because every time we are filling it with stress. So if you do not de-stress, which is taking out of your bucket will be full and overflow, and then you'll be prone to any of these mental health conditions. So relaxation exercises, physical exercises, you know, can also help. Deep breathing exercises, massages, you know, you having a prayer, meditation time with God is even something that can help you to distress. Right? Some people keep grateful journal, or they even journal their days. It helps them to de-stress. Yes.
Thank you. Akpene, this is a very awesome presentation. Thank you very much. My question is on personality disorder. So I know somebody well-educated, she has a PhD, and she's worked in several departments. She moves from this department to that department. And when you talk about her, what everybody says, oh, this lady, she's not correct. So I want to know why, and she's married to Mrs. She's married to, I don't know much about her family though, but I'm sure if she was exhibiting certain traits, her husband would not be able to accommodate her or stay with her. But in the office, any department she goes to, they seem to have a problem with her. So I want to know why she's able to stay at home, stay with her family. She's able to go to school, attain a PhD. But then in the office, everybody says she's not correct. Okay. And then my second question is on postpartum. Okay. What are the causes of postpartum? Okay. And then the third one, you said kleptomania is also part of mental disorder. Can we take medications for kleptomania? Or can it be treated? And then the last one is on mental health disorders, sometimes being genetic. I know a family, the father hasn't got a mental health issue, mother hasn't got a mental health issue, but the sons have mental health issue. And there's another family, father, mother, they are fine, but the whole family, daughters, sons, everybody has mental health issue. If you could explain that further. Thank you.
Okay, thank you. So let me start from the lady with the personality disorder. Oftentimes, personality disorder does not only exhibit in one setting, it exhibits in all the individual social setting. So maybe it is exhibiting at home and at school, but in therapy, seeing the psychiatrist and the psychologist, she's going with her husband. So it is easier for him to know how she behaves, how to help her in the house than for co-workers. Because you are not with her. You do not know the tips and techniques that he has been told to use with her. Right? So if you could, you know, maybe have a forum in your place of work where you talk about that. Have a psychologist come and share some of these thoughts with you about how you can handle somebody like that in your workplace. It would help. Okay. The second question, if I am not mistaken, I don't recall, so if you could, pardon? Postpartum depression. So you wanted to know what causes postpartum depression. Postpartum, any kind of mental health disorder, we don't have causation. We have risk factors. We don't say this is the direct cause to it, right? But then some risk factors we have identified are the hormonal changes that happen with the person, and oftentimes a lot of stress, because most of the women that I've seen with postpartum depression, a lot of stress prior to giving birth and after giving birth. No help, no support can lead them to have the postpartum depression and psychosis. Yeah. The next question. Pardon? Yes, the kleptomania in the family. All right. So in the family, you can have, just as I mentioned, risk factors. The parents can have mental health disorder, and the children will not have. That was one risk factor, which is genetics. There are other risk factors, substance use, there are other genetic risk factors there that maybe the person didn't get a predisposing or what word is that, please? Please let me get that word. One factor, an immediate trigger, let me use that word, an immediate trigger that made the person have that condition. So you can have parents who don't have the mental, but it's there. Genetically it's there. And then you can have the children who have it and their parents do not have it too as well. And the kleptomania, you wanted to find out if there is medication that can be given. It is impulse control condition. So yes, we can give you medication to control the impulse, but it's a lot more behavioral. We do a lot of behavioral therapies for the person to help more than the medications.
In your presentation, you mentioned a condition where the person just feels like sleeping with anybody. I mean, that comes his or her way. I think of a private hostel around, and then I've seen that a lot of the students are predisposed to this. And sometimes they don't even realize it's a condition. You ask some of them, they will tell you that sometime before you get married, you need to taste mini waters so that you can choose the right one.
We understand your question. God bless you. God bless you. We understand your question. God
so
bless
what
you.
I want to say is that about that is risky behaviors, which is about the sex and all of that, is one symptom of bipolar disorder. It is not mutually exclusive. So then again, if the person is exhibiting it, doesn't mean the person has bipolar disorder. It could be behavioral.
Okay, last question.